big question, Jose. I think, when it comes to trust, I think one of the big issues is that people don't understand what AI is. It's like this black box, and it's just you throw something in there, something comes out, and you don't understand why. And this is for patients. This is also for healthcare professionals or anyone who works with the AI. They don't understand what it is. So if I don't understand what it is, why would I trust it? You can also just imagine like the first time a car would come, like you would ever see a car. How would you trust getting into that car? You don't understand what it is, how it works, what makes it even drive. I can imagine that some people back then might even think it was like something supernatural, and I don't dare putting my foot into that. It's a bit similar. Um, Now, but you're at least a car you could see, and you could touch it, you could, but now you cannot. Now it's just something, it's there, you see something like an answer coming out, but you don't understand why is it saying what it's saying, why is it advising what it's advising, based on what. And I think that's a big concern for many, like why would I trust this? And I think tackling that, like the black box, what a lot of people are talking about, would be a big cue to this. So having more transparency in it, explainability, but also understanding what is actually AI. AI is not something that just came up a couple of years ago. We've had AI for years and years and years, but we've just not been aware of it. So it's understanding, like it's a complex question. So you need to understand what the technology is, why is it saying what it's saying, where can it help, including different stakeholders like during the development, but also the implementation, like during and like before and during implementation, actually. And with the stakeholders, not just having stakeholders as the leaders of a hospital or the admins or tech people, you also need to include the ones who are going to use these technologies. So the healthcare professionals, not only doctors, including other healthcare professionals as well, that will be influenced by this, and patients. Because the patients, even though the patients are not going to necessarily be the users, they are going to be impacted by it. And if the patients don't trust AI being used, well, it doesn't matter if the doctor trusts it, because they don't want the doctor to be using it. So it's a complex aspect, and I think you need to like work on it from different levels. So you need to have some education, you need to have use tools that are more transparent and explainable. You need to have including everyone in the implementation of it.